Hi everyone, this is Dr. Sophia Beecher and welcome to another Tooth Talk Thursdays. So today we're going to be starting our back to school series, which is going to be talking about common dental problems in children. Alright, so today we're going to be talking about cavities. So firstly, what is a cavity? Very simply, right, oversimplification, a cavity is a hole in the tooth. That's what everybody knows it as. Okay, so how do cavities form then? It all starts with plaque. Alright, so plaque is this film, this very sticky film that forms on your teeth hours after you are brushed, and it consists of bacteria, it consists of your saliva, consists of food debris in your mouth, right? So the bacteria that live in your mouth, once they have formed this sticky film called plaque, they produce acids, and that acid serves to start to thin out the enamel there without brushing, and the more it's going to keep producing acid and it's going to break down the enamel. So you have a progression to a cavity. Alright, so how to tell if you have a cavity? So cavities start as these little white spots, right? You find them very commonly by the gum line, which is where the food normally accumulates because you're not clearing it away with a toothbrush. Or it can be found in the grooves of the chewing surface where the food will accumulate after you have eaten. So it starts with a white spot, or it may look like a brown spot, right? Those are normally just in the enamel, and then it will progress to you having a little hole in the tooth. So it will progress from the outer layer of the enamel to the dentine, where you'll start to feel a little sensitivity if you have something sweet or you have something cold, and then once it progresses and it's very close to the pulp or the nerve, then you'll start getting temperature sensitivity, more temperature sensitivity, or you may end up with unstimulated pain. So you'll find that you'll just be sitting there, and especially at night, the tooth will just start hurting. So by that time, it's normally pretty far gone. So groups at risk of cavities, everyone. All right. So you have the babies who you leave them to sleep on the breast, or you leave them to sleep with a bottle in their mouth. Those are at high risk for getting cavities. You have children who snack unhealthily, children who snack often, children who will drink a lot of juice instead of water, will eat a lot of sweet foods, right? Especially processed sweet foods, or they may eat a lot of carbohydrate-rich foods which are very sticky and soft. Those are also at very high risk for cavities. Children who are unmonitored when they're brushing, and this is especially important for children under the age of 7, because until you can tie your shoelaces, you do not have the dexterity to brush your teeth properly. And I find that too many of us as parents, we just say, oh, they can brush their teeth, and you just leave them alone, right? You need to check. Even if the child wants to exert some independence, that's great. But if they're under 7, I would advise to double check and to double brush for them, especially at night, all right? If you have poor oral hygiene, so you're not brushing your teeth at night, so you're sleeping with the food on the teeth, that's especially critical, because at night you don't have saliva, which helps to protect the teeth, and so you're more prone to getting cavities if you fall asleep with the food on the teeth. Also, if you have disabilities, all right, whether physical or mental disabilities, anything that will affect your dexterity, right? Anything that will, so for example, the elderly also are very high risk because they normally have dexterity issues, they normally have vision issues, and they normally have a soft, sticky diet. All right. Uncontrolled diabetics as well. You can see our talk on diabetes and oral health. So how do we help as a dentist? Well, first things, we give diet advice. So when I spoke about your child's first dental visit, we spoke about the age that you should bring the child at. And it's very important to bring them as soon as they get their first teeth, or at least by 1 year, because we need to be advising you properly in terms of how to care for that child's teeth. So dental diet advice. avoiding sticky foods, avoiding sweet foods, avoiding sweet juices. Even if they say that they are sugar free, they are loaded with sugar, right? And fruits and vegetables. Also, oral hygiene instructions. So we'll show you how to brush, we'll show you how to floss. Some people don't know what floss is, right? We introduce you to that, and we show you how to use it, which is very, very important. You can see my other video with the other. Hi Maurice, thanks for joining. Yes, we did a video where we showed you all of the dental aids. So the toothbrushes ranging from manual to electric, the flosses, the floss threaders, the proxy brushes, all of those things that help you to get rid of the plaque, right? We also do preventative fluoride treatments for children especially. Sometimes I may do it for the elderly that have issues and they have a lot of plaque and they have a lot of cavities. Oh, another high-risk group for cavities, patients that have dry mouth, chronic dry mouth. All right, that's another thing, because if you don't have the saliva, then you'll be more prone to getting the cavities. All right, so we also do sealants, right, especially for the kids. When their first permanent molars come up, we apply this little coating to them and let it set with a light. It's pain-free, and it can reduce their incidence of getting cavities in the chewing surfaces by about 80%. So very effective. Also, we do screening to check and see if you have cavities. And that screening involves examinations as well as x-rays, because apart from the surfaces that you can see, cavities tend to develop a lot by the gum line, which we really can't see if it's developing under the gum, and they tend to develop between the teeth, which is also kind of hard to visualize until it gets to a certain point. So the x-rays are also extremely useful for that. In terms of treatment can range from us. If it's just the white spots or brown spots, we may the more conservative of us, like myself, we may choose to do sealants just to seal up those areas to prevent the cavities from getting worse. And especially in children who tend to be pretty nervous, right? It's an opportunity to help them without having to do any drilling at that time, right? So even if we can delay doing the filling for maybe like 2 years, I find it to be very helpful in those very early stages. Also, the conventional fillings, right? And if the cavities are really bad and you're experiencing pain, then you're looking at your root canal treatments, which is removing the nerve from the tooth, so you get to keep the tooth, or unfortunately some of the times extracting the tooth. Alright, so join us next week. We're going to be doing part 2 of our back to school series. Thank you so much for listening. Thanks for joining Maurice again, and take care. Stay safe.